Hi, this is Dr. Price again from the Wellness Center. Today I want to give you an example of what is Kinesio taping. Kinesio tape is a tape that uses a kinesiology of your body to realign joints, to change muscle tension, and remove pain from things like plantar fasciitis, is which we're going to tape today for an example. Anywhere from low back strains to where we can inhibit muscles or facilitate muscles to either turn them on or turn them off. Rotator cuff injuries, whiplash, we can tape for that in the neck. But today, very simply, we're going to tape for plantar fasciitis. So plantar fasciitis is typically caused by an overactive soleus muscle, which is the muscle underneath the gastrocnemius. That's the muscle in the calf you can see. But the soleus is underneath that. So what we want to do is we want to tape to take the tension off of that muscle, as well as then that pulls around the calcaneus and pulls tension on the plantar fascia. So by turning off both of those muscles, we can relieve the tension and make plantar fasciitis go away. So what we do is this tape has got actual stretch to it, so then when we stretch the tape, that tape has recoil that pulls tension on that muscle and basically turns it off. So this is how we're going to tape for plantar fasciitis. So we pull the tape at both sides here. It's already been pre-cut by me for this. We anchor it onto the Achilles tendon. And this is good for any avid athletes, just weekend warriors, whatever it is. If you've got any plantar fascia symptoms, this tape can really help. It stays on for 4 or 5 days. You can shower with it. You can do everything you would normally do with it. So now I'm coming around the calcaneus. I'm going down the length of the plantar fascia. And again, this tape has recoil, so it's pulling this muscle very slightly, and that neurologically will help turn off this muscle. Right along the length of each muscle. So that's taping the plantar fascia. Now I want to have her flex her foot. That puts tension into the soleus muscle. And again, we traction the tape up the length of the soleus muscle. And then that takes the tension, because it's pulling the muscle this way, taking the tension out of it, and pulling the muscle this way, taking the tension out of that. And the last thing we want to do is support the arch so she doesn't have any medial breakdown of her foot. So we come right into the arch. Again, you can see how I can tension this tape. So I tension the tape around the outside, right across the top of the foot. And that, via kinesiology, can help remove the symptoms of plantar fasciitis.